Good evening to you. Welcome to Health and Lifestyle Show that runs on AIT TV and Bunyoro TV. I'm Onesmus, Byamukama, and I'm an obstetrician gynecologist in the Department of Obstetrics and Gynecology at Mbarara Regional Referral Hospital and Mbarara University of Science and Technology. And I'm also doing a fellowship in urogynecology and female pelvic floor medicine. Today I'm going to share with you about one of the most common conditions that we see on the ward, and that is cancer of the cervix. I will be sharing with you what it is all about, what causes it, which women are likely to have it, how do we prevent it, how do we treat it, and how do these women present. Cancer of the cervix is abnormal growth of cells at the mouth of the womb or of the uterus of a woman. Now, this abnormal growth of these cells continues unregulated. The body has a way in which it regulates the growth of cells and kills the abnormal cells. But this is unregulated, uncontrolled, and these cells are never killed by the body. And as a result, this growth continues and results into what we call cervical cancer. Cervical cancer right now in Uganda is the leading cause of cancer-related deaths amongst women. And it is also the most common cancer in Uganda. And that puts it at a very, very dangerous position for our girls and our mothers and our wives. And that is the reason why we are talking about it today. Each year in Uganda, we diagnose new cases of about 6,400 new cases of cancer that are being diagnosed. And still each year we lose about 4,300 patients from cervical cancer related deaths. That shows you how big this problem is. And remember, these are women that come to the hospital. These are women that we get with our routine screening. But a number of these women are actually are not coming to the hospital. So we have many of them that die of cervical cancer and it's not reported. Okay? And you know, as we advocate for screening, as we advocate for diagnosis, we have to go down to the people that do not come to the hospital even when they have these symptoms. What causes cervical cancer? Cervical cancer is caused by a virus that we call the human papilloma virus. And there are specific types which we call high risk that do cause this, and there are many of them. The human papilloma virus is transmitted in the same way that HIV is transmitted, that things like gonorrhea, chlamydia, which are sexually transmitted diseases, are transmitted. And therefore, the human papilloma virus is a sexually transmitted disease. And the infection that you get with the human papilloma virus, if not cleared by the body and it becomes persistent, it can cause these abnormal changes on the cervix that will later on lead to cervical cancer. Cervical cancer happens, or there are people that are at risk of getting this cancer. And these are people that are engaged in promiscuous activities, prostitution, mainly those that have many sexual partners, or if the women have husbands that have many sexual partners, they are more likely going to get cervical cancer. But also, there are other things if you suffer from sexually transmitted diseases. And especially we know this by the discharges. If you're ever getting discharges many times, they are treated, and you again get discharges that we think are sexually transmitted, that also puts you at a risk. People that are immune suppressed, especially people that have HIV/AIDS, people that have things like chronic kidney disease, people that have malnutrition, they are at more risk of getting cervical cancer because their immunity in the body is less and so cannot clear the infection. But also those women that have delivered so many children, and again, girls that started sexual intercourse at a very young age, or if they deliver at a very young age, less than 20 years, they are more at risk of getting the human papillomavirus, which can later on lead to cervical cancer. The human papillomavirus itself is cleared by the body, and women get it, it's cleared by the body all the time. It requires about 1 to 2 years to be cleared by the body. But if you have an additional risk, like recurrent sexually transmitted diseases, HIV/AIDS that we talked about, immune suppression of any form, then it lowers your immunity and you are unable to clear the infection. And the persistence of this infection is what will later on lead you to getting cervical cancer. Cervical cancer can be preventable. It's a preventable disease. And I want to say this with a smile, because if we all understood that it's preventable, we can join hands to fight it. And how do we prevent it? Number one, behavior change. Let's abstain. If you're not yet married, abstain from sex. Be faithful to your partner if you're married. Because if you're not having so many sexual partners, there is a less likely chance that you're going to get this sexually transmitted disease. But again, in the prevention, our young girls can actually be vaccinated against the human papillomavirus. And we have the vaccines in Uganda. They are available at any immunization center. If you walk in and you say that you want a human papillomavirus vaccine, you're actually able to get it. We immunize mainly the P5 school-going girls, or those that are between 9 and 13 years. But any girl who has never had any sexual contact can actually get this vaccine and be vaccinated. But also we emphasize the other forms of prevention, screening. We say that women should screen every 3 years. You should get to know your cervical cancer status every 3 years. And these screening services are available in our facilities right away from a health center 3. We have trained midwives, we have trained doctors, we have trained health workers to do the screening. When you screen and they tell you that you do not have cervical cancer, or you do not have changes that can later on lead to cervical cancer, you take another 3 years to screen. When we screen you and we find that you have abnormal cells on the cervix, we treat the abnormal cells, and that gives you a long period of protection before you can acquire another virus that can later on lead to cervical cancer. And that's why I'm saying it's preventable. Okay, so I call upon women, girls to come and screen at all our facilities. We have the services available. The human papillomavirus takes a very long time, 10 to 20 years to cause cervical cancer. And therefore, if you screen during this time frequently, we are likely to detect changes and treat them. Okay, and that's why we are emphasizing the screening point. Patients with cervical cancer, how do they present to us? One, they come normally with lower abdominal pain. They feel pain in the lower part of abdomen, but do not confuse this. So many things can cause pain in the lower part of the abdomen, like urinary tract infections, like pelvic inflammatory diseases. But either way, if you have lower abdominal pain, it's something that tells us that we should look at your cervix. Again, they tend to come with abnormal discharges, and these discharges normally are smelly, they are pus-like, sometimes they have blood stains in them, and they are offensive, they are not pleasant. And whenever someone comes with an abnormal vaginal discharge or discharge from your private part, it warrants us to look at your cervix. A number of women come with abnormal vaginal bleeding. That is bleeding that is outside your menstruation. And normally they see the bleeding that when they do not anticipate their menses, but also whenever they have intercourse with their husbands, they see blood, which we call contact bleeding. And this contact bleeding is makes us to be suspicious that this person might be having cervical cancer. Again, some women do come when whenever they meet with their husbands, they feel pain. And this pain could be because they are hitting the mass during the intercourse. And so whenever a woman tells us, I feel pain whenever I'm meeting with my husband, we get to test them or to screen them or check if they might be having cervical cancer or not. Those that present late can present with other complicated symptoms, like a deep venous thrombosis, where you have a clot in one of the legs. But also other things that we already see is because of the continuous bleeding and because of the progress of the cancer, patients tend to come in when they are anemic, when they have low blood levels. They tend to come in when they are already in renal failure, when their kidneys have stopped working. Other times they come in with chest complications, abdominal complications like liver failure and the rest. Or sometimes actually they come in when they have already a fistula, what we call a fistula, to the bladder, to the rectum, and you find that they are either leaking urine or they are leaking stool from their private parts. And so all these tell us that someone might be having cervical cancer, and therefore you need to check them for cervical cancer. Is cervical cancer curable? The question, I will approach it in two ways. One, if cervical cancer is detected at an early stage, there are so many stages, up to 4B of cervical cancer. So when we detect cervical cancer at an early stage, it can actually be treated. We can give a curative method of treatment, and that is surgery. So we can treat with an operation, and we say the patient, we follow up the patient, and we say the patient is cured. The problem comes in when you come in when it's late. When it's late and the cancer has already gone, has already moved to other parts, because it tends to spread to the other parts that are neighboring the uterus and the cervix. So if it's beyond surgery, we say that the cancer is no longer curable. And so we cannot treat it with surgery. But there are other means that we can use to treat the cancer to stop it from causing you more complication. And one of the means is by exposing you to what we call radiotherapy. Radiotherapy, it will cause, the Banyankole call it oxylysis. It causes oxylysis of the cancer cells such that they do not continuously grow or they do not continuously spread to the other parts of the body. And that gives you more time. We give you pain medication, we correct your blood levels in case the blood levels are low, and we try to give you the supportive management whenever necessary. The challenge that we have is that this machine that does radiotherapy is not available in our setting. And so it's in Mulago. So whenever we get patients that come to us when it is already late, we send them to Mulago for treatment with radiotherapy. But for surgery, we are able to do surgery at Mbarara Regional Referral Hospital. And we have the trained personnel that are able to do these surgeries. And so whenever you are diagnosed with cervical cancer, please come to us at Mbarara Regional Referral Hospital. We screen you, we get to know at what stage your cancer is, can we offer treatment, or we should send you to Mulago. Even in Mulago, we link you up. In case we send you to Mulago, we link you up and you're able to be given the appropriate treatment. I've seen a number of asked questions by the people who watch this program, and I would like to take time and respond to them. One person asks if all cervical cancers are the same. Now, there are different types of cervical cancers, the different histological types. What is important for us to know is that if it is cervical cancer, it is cervical cancer. But some of the major ones that we have are, for example, the squamous cell cancers and the adenocarcinomas. And we have, those are the major two ones, but we have the other types that are very rare. But whether it is a squamous cell, whether it is an adenocarcinoma, whether it is the rare ones like the rhabdomyosarcomas, they are all cervical cancer, and we take them as the same, and the treatment options are guided by the stage of the cancer. The other question is someone asks, do you know what causes or which factors provoke cervical cancer? Like I said, the virus, the human papilloma virus, is what causes cervical cancer. But it initially gives you an infection, and this infection can be cleared by the body if your immunity is competent. At times, because of the low immunity, or because of the persistency of the infection, this virus can lead to abnormal changes on the cervix. Now, it is these abnormal changes that can later on, if not detected and treated, they can turn into cervical cancer. Cervical cancer just means that you've had unregulated cell growth, okay? And someone asks, how do you get infected with HPV? Can anything be done to prevent the infection? Like I said, the infection with HPV is mainly by sexual contact. And so they are sexually transmitted. And sexual contact can be anything. In this case, it can be genitalia to genitalia. For example, the penetrative sex. It can be genitalia to skin. It can be skin to skin. HPV is even more dangerous than HIV because you do not necessarily need penetrative sex to transmit it. There are other cases that have been reported of vertical transmission from mother to child, but those are very rare. And the other cases of fomites through clothes, patient beddings, but still those are rare. The human papillomavirus can cause other cancers apart from cervical cancer. For example, cancers of the vagina, cancers of the vulva. Even in men, it can cause penile cancers, but also anal cancers in men and women, and oropharyngeal cancers, cancers of the throat in both men and women. So the human papillomavirus is not only specific to cervical cancer, but can cause even other cancers in men, in both men and in women. And so the men should not celebrate that for us we are not going to have cervical cancer. No, the HPV which causes it can actually cause the other types of cancers in men as well. And we talked about the prevention, that behavior change, be faithful to your partner, abstain from sex, as well as have a vaccine for the young girls that have not initiated intercourse. But even for those that have actually initiated intercourse, if you do your HPV DNA and it's negative, we actually encourage you to take on the vaccine. It is very okay. Someone asks that are all cancers treated surgically? And the answer is no. It's only those cancers that are still in their early stages, and specifically those that are still stage 1, which we say the cancer is confined to the cervix. Those ones can be treated surgically and you get cured, except a few types of stage 1 also. Not all stage 1 is treated surgically. But when you're still in stage 1, you still have an early disease, the rate or the chances and the prognosis that you get cured is very high. And that's why we are saying you shouldn't wait until it's late. Whenever you see the symptoms that I talked about, abnormal bleeding, abnormal discharge, if you're having pain whenever you meet with your husband, if you see blood whenever you finish meeting with your husband, low abdominal pain, back pain, please come and we get you screened early enough. Will treatment affect my daily activities? And I would like to say that all this, whether it will affect your daily activities or not, it depends on your overall performance status. Now, for those that are in stage 1 and we get to treat them and they get cured, once we declare that you're cured, then you can actually resume your daily activities. For those that are on radiotherapy, they might be having limited activities, and also due to the fact that there are side effects of the chemotherapy and the radiotherapy, they might be having limited activities that they do perform. But however, if the stage was still low, there is a high chance that you're still going to resume your daily activities. If it was a late stage, then it might be hard for you to resume your daily activities. How will I be followed up? That is a very important question. the follow-up for anyone who has cancer, any type of cancer, is for life. And so even when you have cervical cancer and we get to treat you, even when we declare you cured, we follow you up for life. And for those that have late diseases, we also follow you up until the end of life. And during the follow-up, we want to know, are you still okay? Has something new come? Is there something that is suspicious that we should reevaluate? If you still have the cancer, is the cancer progressive to another stage? Can we stop the cancer from progressing to another stage? And those are the things that we are interested in during the follow-up. An important thing about smoking, someone is asking about smoking. Smoking itself can actually cause cervical cancer, even without the human papillomavirus. And so if there is a woman there who is smoking, smoking itself puts you at risk of cervical cancer. However, if you're smoking and you also have these other risk factors that we talked about, for example, you have multiple sexual partners, or your partner has multiple sexual partners, you're suffering from STDs, you're HIV positive, that also puts you at an added risk factor for getting cervical cancer. And therefore, smoking can cause some changes in the cervix that might lead to abnormal proliferation, abnormal growth of cells, and this will later on lead to cervical cancer. How do we know that the treatment is working? Thank you for that question. Yes, we know that the treatment that we have offered is working when we repeat tests, a number of tests, including scans, and also testing for your functionality of the organs to see if they are okay or not, if there is any new disease progression or not. If there is no disease progression, no new disease detected, and you're generally performing well and improving, then we know that our treatment is working. But if we see new things that are developing in your body, new complaints, the symptoms are not going, then we know that actually the treatment is not working. Thank you so much. I think I've talked a lot about cervical cancer. Importantly, cervical cancer is preventable, and we can prevent it by taking the vaccines which are available to us and by doing regular screening. Everyone, every girl child, every woman who is 25 years and above, or every woman who has delivered already should get to the screening points and they get screened. And in case you're HIV positive and you have already initiated intercourse, please, it does not matter whether you're below 25 or not, you can go to the service points and you be screened. The screening methods are so many that we use. We can just take part of your cervical fluids and vaginal fluids, and we do what we call an HPV DNA. We look for the virus. Okay, we look for the virus. Or we can use some water. There's water that we call acetic acid. We can use acetic acid and put it on your cervix and see if there is a change on the cervix that might indicate that your cells are abnormal. But we can also do other things like taking a part of a small biopsy or a small muscle piece from your cervix and taking it for diagnosis in the lab. Or even other things like, taking cells from the cervix and we take them for screening and diagnosis. And all these are not painful procedures. Some of them you can even do them yourself. Some of them it's just a 5-minute or even less procedure, and all is told to you after that. And I want to ask each and everyone who is listening to me that you join hands with me and we fight cervical cancer. Because in Uganda right now, we have the highest prevalence in sub-Saharan Africa. You can imagine that. But this is a preventable disease. Thank you so much. God bless you. I remain Onesmus Byamukama.
You're watching a Youth TV, empowering you.